I chose hospice when Mom came to the nursing home for several reasons. Mom was approaching 100. I was familiar with hospice because my dad used hospice. It was wonderful that Mom qualified, and it's always good to have an extra pair of eyes and some extra feedback. And the nurses work in tandem with the hospice nurses.
When a patient is first referred to Hospice of Westchester, we come out and assess the patient to see if they're hospice appropriate. Then we contact a family member to discuss the policy, procedure, and the philosophy of our program. I meet with the facility team, including the doctor and the nurses and social workers, so that they can give me a little background on the patient. We will then make recommendations and referrals based on what I feel the patient needs. And then we put everybody in place.
The list of hospice services is long and wonderful, starting off with Reverend Jesse. Mom is very spiritual, and having someone tend to that spiritual side is extremely important for Mom and also for the family.
One of the things that I bring into the facility is my time and my presence in the room with the patient, and also my spiritual support, not only to the patient, but to the home health aides that are there with them.
Plan of care meetings are held once a month for a patient. If a family member can attend, it's done at a round table. If not, we do it over the phone. It's the registered nurse that visits the patient, social worker, which helps with planning, support for patients' families, and spiritual chaplain.
Whether a patient is religious, non-religious, spiritual, or secular, we at Hospice of Westchester provide care to everyone.
We also had social workers. Sister Pat comes and tends to Mom and talks to Mom, and then gives me a weekly update in terms of Mom's mental status, how she's doing, is she depressed, is she not depressed? And thank God Mom has been very, very happy.
I think it's particularly helpful for family members to know that they have a lot of resources within the hospice program, especially when patients are in a facility. The family member is somewhat not as connected on the day-to-day basis, so they can count on us to be there for them, for any of their concerns.
I always look at it this way: how would I like to be treated? How if I was in their place, what would I want?
This is Shivian, Westchester Hospice's home health care aide, and she is an angel. She goes above and beyond the call of duty. She knows my mother as well as I know my mother, and she knows her personality. I mean, Shivian is part of the family. She not only cares for her physical well-being, but her mental well-being, and part of that mental well-being is being put together, and that's very important for my mother. And she's just another one of the Westchester Hospice angels.
I walk in the room and she's so happy to see me. She even noticed on a daily basis if I'm sad or if I'm happy. She can tell from my look. And the family is also happy knowing when I am here for them. And I keep the family informed on a daily basis and what's going on, because it gives them comfort knowing that we are there and what's going on with their mom.
She also has musical therapy here, which keeps her going. One time, Mom had so many services from hospice come to the nursing facility that she said to me she had a very busy day and she had so many visitors that she was exhausted. So I'm very grateful for the varied services that come to help Mom. I really am. It's a wonderful addition to what the nursing home provides.